Hi, Dr. Yass here. In this video, I want to talk about a recent case I had and really try to impress upon you the level of lack of accuracy in what is told to individuals upon having pain trying to get a proper diagnosis. And I want you to see the difference between what happens when you go to a surgeon who fits into the medical establishment view of taking an MRI to identify the cause of pain versus getting an evaluation through the Yass method. And in this particular case, I'm talking about a 17-year-old boy I recently treated. He's had shoulder pain for about 2 years and just was trying to live with it, and it was affecting his ability to use his arm. And eventually he felt he couldn't deal with it anymore and he had to seek care. So a few months ago, he gets an MRI, goes to the orthopedic surgeon, suggests that he gets an MRI, and the MRI shows a torn labrum. And at the time, the guy is saying, this is where my pain is. This is where my pain is, right here. This is where my pain is. And the surgeon says, you're touching your labrum. You have a torn labrum. You're touching the torn labrum. That's why you feel the pain there. And what we recommend is that you try physical therapy first so that you can strengthen the muscle surrounding the shoulder to stabilize the labrum. And that should help resolve your pain. Now, there's two key things that I want you to understand if you plan on living in the real world, the world of reality, where you can actually understand things if you take a logical approach to analyzing the cause and then resolving that cause. So I thought that a picture would help you understand this better. And so here we're looking at a picture of the shoulder joint. And as you can see, inside the shoulder joint, right here, where the head of the arm bone enters the shoulder joint, this is the shoulder blade, and here is the labrum. And so everyone could understand, there is a concavity called the glenoid fossa, which is on the inside of the shoulder blade. That's what the upper arm bone attaches into. And you have this extension of the bone, which is made of cartilage. Labrum is made of cartilage. And so the labrum is just an attempt to increase the depth of the concavity that the arm bone sits in so that there's greater sense of stability. So that's what the labrum is. It sits around the glenoid fossa. It's made of cartilage, and it's designed to increase the depth of the concavity so the arm bone sits in there with a greater sense of stability. Now, clearly, this is inside the shoulder joint. So when this 17-year-old boy touched his shoulder, the front of his shoulder, and he was told that he's touching his labrum, hopefully anyone who looks at this would say that's an insane statement. And how anyone would make that statement, in my mind, is criminal to say to anybody, because it's literally impossible. You should clearly be able to recognize you can't touch your labrum. Okay? What he was touching, he was putting his hand right here. That's where he was pressing on the right shoulder. He's pressing right here. And what he's actually pressing on is the biceps tendon. This is the biceps muscle. The biceps tendon, the long head, runs through the shoulder joint between the upper arm bone and what's known as the acromion process, which is the top of the shoulder blade. So this is a space right here between the upper arm bone and the shoulder joint, the acromion process, and the bicep tendon runs through. So what he was, when he was complaining of pain and pressed on the spot, he was pressing on that, okay? So pictorially, you can see the labrum is inside the shoulder, completely impossible to touch. And what he happened to be touching was the biceps tendon. So let's go on to the next concept, that the cause of the pain is the tear. So again, I want you to understand things from a logical perspective, and I'm going to give this in a mathematical equation. Tear equals pain, therefore X equals no pain. Tear equals pain, X equals no pain. What would you think X should represent? I hope we'll all come to the same agreement that X should represent no tear. So if a tear causes pain, the answer would be that no tear causes no pain. And therefore, logically, if you were told that a tear was causing your pain, the only way to make you not have pain would be to surgically resolve the tear. Hopefully everyone would see that as logic. So the fact that they're telling this kid that by stabilizing the muscles that that's going to do something, what does that even mean? Where's the logic? There's no logic. Tear equals pain. No tear equals no pain. It should be as clear as day to anybody seeing this. So right here, you have two concepts that should scare you to the bejesus in seeking care from an orthopedic surgeon when they'll tell you that you can touch your labrum and that if a tear is creating your pain, strengthening the muscles surrounding the tear is somehow going to make you not have pain. You have to start taking control of your destiny and the type of treatment you receive. And just because you get information in doesn't make that information logical or something that warrants your consideration. You have to start taking responsibility and thinking through the information and seeing if it makes sense. So clearly that didn't make sense. The fact that this kid was saying that when he moved his arm, that's what brought in the pain should help you understand that it was muscular. When I pressed on the bicep tendon, it brought on the exact pain the guy was complaining of, which tells you that the pain was coming from the bicep tendon. It was known as point tender pain. The tissue I'm pressing on is the tissue eliciting his pain. So clearly his pain is coming from the bicep tendon, not the joint itself. The reason the pain was coming from the bicep tendon was because when he was moving his arm, the head of the arm bone, as you can see here, the head of that arm bone, when he raised his arm, the head of the arm bone was rising, and the space between the acromion process and the head of the arm bone was shrinking. So anything that sits in this space was going to get pinched, which in fact is the bicep tendon. So because the arm bone was rising due to a weakened rotator cuff, he had a strained rotator cuff, not a torn rotator cuff, but a strained rotator cuff, and other muscles surrounding the shoulder blade were weak. Those muscles are required to keep the shoulder blade stable against the rib cage so the rotator cuff can pull off of its attachment of the shoulder blade and pull the head of the arm bone down as the arm is raised to protect that space between the upper arm bone and the shoulder bone. That's what was causing his pain. So he had what is known as impingement. He was impinging on the subacromial space because the arm bone was rising inappropriately due to the lack of strength of the rotator cuff to pull it down. And that's why he pinched his bicep tendon. So all we had to do was a few exercises, and he felt dramatically less pain when he moved his arm. So here's an example. If this sounds like something you've experienced, well, take to heart that now you're understanding logically why you can't touch a labrum and why the idea of stabilizing a tear by strengthening muscles arbitrarily doesn't do anything to take away the pain if in fact it was coming from a tear. Tear equals pain. No tear equals no pain. That's it. That's what you have to understand. And secondly, recognize that the identification of a labral tear is typically an independent variable to the cause of pain. That tear in almost all cases I've treated when it was identified, was a degenerative tear. So if that arm bone is rising due to inappropriate bone mechanics from weakened muscles, you can see that that labrum wraps around. It's going to rub against the labrum as well as the bicep tendon. And slowly it's going to wear away the labrum, which is going to cause a tear. But that doesn't mean the tear is causing the pain. I was able to show you based on pressing on that bicep tendon that that's where the pain was coming from, the tendon, not the shoulder joint. And with the appropriate strengthening, you resolve your pain and achieve full function of the shoulder. So please, let's start taking in information and thinking about it and seeing if it makes sense. And if you need somebody to bounce your situation off of to see if it makes sense, then contact me by email, drmitch@mitchellyass.com. Tell me your story. I'll explain the circumstances and I'll be able to tell you whether it sounds like the cause of your pain is muscular or whether it's structural. If it's structural, then you need surgery. But I've shown in more than 98% of cases, even when the structural variations are identified on MRIs, which is a baseless mechanism of diagnosing the cause of pain, it was muscular. And with the appropriate strengthening, you resolve your pain, get your full function back, keep control of your strength, and you never have to deal with this nonsense any further. So if you want, contact me at drmitch@mitchellyass.com. If you think this is making sense and you want to actually schedule a Zoom session, if you're outside the Jacksonville area, you can do so on my website, Live Without Pains, plural, livewithoutpains.com. If you're in the Jacksonville area or you want to fly or drive into the Jacksonville area for a couple of days and get treatment at my facility, you can do so on the scheduler as well, livewithoutpains.com. There are two potential choices you can make: in-person sessions or Zoom. Take your choice. If you can get here, great. If not, we do a Zoom session. I've done them for people all over different countries. They're highly effective. All you need is a resistance band and a chair to do it. The sessions are videotaped to make sure you're doing things correctly. We do 2-week follow-ups to make sure everything is working out as you need it to be. And we follow you through until you're pain-free and fully functional. If you like this video, you think it's helping you make sense of things, please give it a thumbs up. If you like my YouTube channel, Dr. Mitchell Yass, please subscribe and press the little bell icon to get notifications when new videos are added or when I'm live on YouTube. So for now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye for now.